Craig for 5 minutes.
Thank you so much, Madam Chair. Over the past month, I know abortion providers across this country have had to face a new reality, that performing a medical procedure to care for their patient may soon become or is illegal. As we've heard today, the fear of criminalization has created a chilling effect on medical providers across the country, particularly on those that provide abortion. Dr. Verma, let me start with you. This must be an incredibly challenging time for you and the entire healthcare community. How are your colleagues reacting to these bans?
Thank you so much for that question. I also want to just start by addressing some of the implications today that as doctors who provide abortion care, we don't understand the complexities involved in reproductive health care. So I also provide full spectrum OBGYN care. I've spent countless nights watching fetal heart tracings on labor and delivery, looking for any sign of distress to make sure that my patients' babies are safe and healthy. I understand the complexities of reproductive health care. I also understand that my patients don't lose their agency or autonomy or lives because they become pregnant. And so I just wanted to say that for the record. My colleagues and I are struggling right now. This is a really hard time. We went into medicine to do what was best for our patients. We went into this because we care about our communities. And we, because of these bans, are not able to provide the best evidence-based care that is supported by the scientific medical community to our patients.
Thank you so much. I know a lot has been covered today about Republicans, my colleagues' efforts to put in place a nationwide abortion ban and those state efforts to criminalize abortion care. Dr. Verma, what will happen in your profession if abortion is criminalized?
We're going to see that our patients won't be able to get the care that we need. We're going to see that our trainees, our medical students, our residents are not going to get the training that they need to provide life-saving care. That includes abortion care. It also includes miscarriage management. So we're concerned that because of these abortion bans, our residents are not going to be able to provide that life-saving care to someone who comes in and needs it. And I've already talked to medical students from the South who want to stay in their communities, but they say, I don't think I can get the training I need to be the doctor I want to be in the South, and they're leaving. And that's devastating for me as someone from the South. That's my home, my community. It's completely devastating to see that we're losing these doctors because they can't get the training or provide the care that they want to, that they need to because of these abortion restrictions.
Thank you so much, Dr. Verma. Dr. Guerrero, your organization's work depends on a network of competent, available providers so that you can appropriately link people to care. Dr. Guerrero, how has the threat of criminalization of abortion providers affected the type of services the clinicians in your network have been willing to offer since the Dobbs decision came down?
Well, as we know, July 25th will be a special session in Indiana, and that is when abortion will effectively be banned in Indiana, which means that those clinics will have to be shuttered, and we will have to refer 100% of our patients outside of the state. But I also just want to take the opportunity to go back to the idea of the kinds of services that we provide, the full spectrum of services we provide. We have a diaper bank for a reason, and this is my colleague, this is for Jess Marchbank. We have a diaper bank for a reason, because WIC and Medicaid do not cover diapers, and Republicans have blocked many proposals on different states to have WIC and Medicaid cover diapers. We offer 3 to 4 packs a month to our clients. The local CBC gives their clients 3 to 4 diapers, which if you've ever diapered an infant, you know that's not going to get you very far, especially if the infant is sick. And so just a couple years ago, our Democrat representative tried to introduce a bill that would take taxes off of diapers, which was blocked by Republicans. So the fact that Republican pro-life factions want to sit here and talk about children and babies, and then they go ahead and do this when it comes to just basic care, like diapering, it's hypocrisy at the highest order. Thanks.
Dr. Guerrero, I'm out of time, but I just want to say that I just can't believe we're here in America. With that, Madam Chair, I yield.
I thank the gentlelady, and now batting cleanup is our wonderful author of the bill last week to allow travel across state borders, Ms. Fletcher, for 5 minutes.
Thank you